Welcome back to Therapy Thursday. You've thrown your back out. It can be super frustrating both for you, but also for us as clinicians, because oftentimes it's somewhat difficult to give acute care management advice. You just want the pain to decrease so you can actually start to work with the individual. There's a number of gold standard positions. I'm an advocate of the McKenzie method, where it's a lot of extension-based care for the majority of acute low back pain patients that are likely, or you're suspicious, they may be experiencing pain from a lumbar disc. So what is a lumbar disc? Each one of these guys are vertebral bodies. In between, you've got a disc. You can see when it bulges out to the side, it can make contact with a nerve root, and that's often what causes sciatica, or pain down an individual's leg. A new paper came out this spring, so the spring of 2025 for those watching in the future, that commented on a new position they tried. So this paper was interesting because it's the first one that looked at CT images of these individuals that showed an enclosure because of the disc bulge around the space for the nerve. Then they had the people try this position, and they came back and did it again, and then again 48 hours later. It showed a significant increase in the area, so it allowed more space for the nerve root. It also decreased their objective findings, and it most significantly substantially decreased the individual's pain. So what is this position? It's called the modified reverse contralateral axial rotation position. It's a mouthful, I get it. So I'm going to show you what that position looks like. But the essence of it is that you're trying to put the body in the position. Let's say this is where a disc bulge is, that you are opening the space as seen there for the nerve root itself. So the way that they chose to do that was they had the person side lie, like so. Their top leg would go into extension and their bottom leg up to a 90-degree angle. And then they would rotate down and hug the table like so. Now, to even accentuate that position a little bit, they would have the individual lay on something like a 15 to 30 centimeter block just above their iliac crest, so just above the side of your hip. The symptomatic side is this top side because that's the one that you're trying to parse to open up a little bit. Now, again, this study had excellent findings, but there's a few caveats. First and foremost, it was on younger, healthy people. So these people had a history of at least 3 months of severe leg pain going down their leg. They did pre-imaging to show they all had similar types of disc bulges, just at different levels, but they were young and healthy. So that's caveat number one. Caveat two, the length of time they asked the people to lay in that position would be tough for many people with acute back pain. They actually had people lay in that sustained position 4 times for 20 minutes, 2 days in a row, and then they did the follow-up imaging to show the substantial improvements. Caveat 3, and by far the most important, I'm just outlining a paper here. Every individual's low back pain is different. The most important thing that you can do if you're suffering from low back pain, or if you found this video by searching that paper or otherwise, is to go to a trusted therapist, have them assess what's actually going on with your back. You can ask them about this paper if they're familiar with it, so they can look it up, but it's not for everybody. So keeping all that in mind, it was the first paper, hopefully of many, looking at this position for acute low back pain. We're trying it out in clinic to see if it helps improve people in the acute state, so that then we can move them around and help them rehab and get back to function much quicker. See you next time on Therapy Thursday.